The cardiac conduction system. The cardiac conduction system is the body's natural, built-in electrical system, which generates and transmits the impulse to ensure the chambers contract in a coordinated rhythm. The purpose of it is to generate and conduct electrical impulses, which coordinates the heart's muscle that contracts to pump the blood throughout the body. The cardiac system, some of the components that are involved with it is the SA nod, which is the heart's natural pacemaker. It initiates the signal and then it travels through the AV node, which briefly delays, so it allows the atria to finish the contracting of it. Then it moves through the bundle of His, which the bundle of branches is involved as well, and it branches out to the left and right. And then from there, it goes through to the Purkinje fibers, which conducts the impulse to the verticils, causing them to contract. One of the components in function is the SA node, which is the sinoatrial node, which is located to the right atrium. It comes in just underneath the superior vena cava. So then this is also known as the heart's natural pacemaker. It generates an electrical impulse that causes the atria to contract and pump the blood into the ventricles, which initiates each heartbeat and sets the heart rate into the heart. Another component is the AV node, which is also called the atrioventricular node. This is situated between the atria and the ventricles. This node receives the impulse from the SA node. It delays the signal, which allows the atria to fully empty the blood into the ventricles before the ventricles contract. So the impulse makes a pause, and it's a 0.1 second. And then from there, it connects to the atria to the ventricles. For the next three, they are called the bundle of His, bundle of branches, and the Purkinje fibers, which they all carry the impulse down to the ventricles, stimulating them to contract. The bundle of His is also known as the atrioventricular bundle. So this is the pathway that carries the impulse from the AV node to the bundle branches. Then you have the bundle branches, and the bundle of His divides into the right bundle into the left bundle of branches, which it then rapidly conducts the impulse down the spectrum toward the apex of the heart. Next, you have the Purkinje fibers, and these fibers are spread throughout the ventricular muscle, which delivers the electrical impulse to the ventricular muscle cells, and it then causes the ventricles to contract and pump the blood to the lungs and out to the body as well. So how the system works together with all the components. So the SA node fires by sending an electrical impulse across the atria, causing them to contract. Then from there, the impulse reaches the AV node, where it is briefly delayed, and from there it travels, and the impulse travels down to the bundle of His and into the right and left branches. The bundle branches conduct the impulse to the Purkinje fibers. The Purkinje fibers spread the impulse throughout the ventricles, causing them to contract. A common illness of the cardiac conduction system is heart block. Heart block is when the heart slows down or may skip a beat. It is caused by coronary artery disease and also be caused by a heart attack, which can damage the heart's electrical system. The electrical system signal is slowed down or is blocked as it's traveling through the heart's conduction system. With the heart block, there are 3 different degrees of it, like the stages of levels of it. The first degree is it's often asymptomatic symptom, which is normally not required any treatment for it. The second degree, it can be a little more serious and may require some monitoring or very little treatment. Um, in the second degree, this is where they may recommend putting a pacemaker onto the patient. The third degree of a heart block, this is more of a severe condition. This degree stage, which is the third degree, it requires immediate medical attention. This can also lead to a cardiac arrest. At this stage, it is considered a complete heart block of it going through the conduction system. Some of the symptoms of a heart block is like a slower heart rate, the beats are skipping, shortness of breath. Patient may feel dizziness, maybe fainting, or even fatigue. Some of the treatments for the heart block is one, the patient can be wearing a pacemaker that will help them regulate their heartbeat. Some of the preventions from heart block, is maintaining a healthy lifestyle, like exercising, having a heart healthy diet. It prevents the coronary artery disease that leads usually to a heart block. The patient can control their blood pressure, the cholesterol levels, the blood sugars, which can help prevent from heart disease. Another factor is also limiting and avoiding excessive alcohol use.